Welcome, Rotarians and guests, to the Rotary Club of Pleasanton.
The world's greatest Rotary Club.
So it's an exciting time because Alameda County is getting into the red zone, and it looks like we'll be having a board meeting next week talking about hybrid meetings or maybe in-person meetings. And so spring is here, and hopefully the tail end of this situation that we've been dealing with for about a year. So it's an exciting time. Happy to have you all here. And as you know, our meetings are being recorded through Zoom and uploaded onto YouTube for you to share with your family and friends. So we'll start with the pledge with Ruve.
Okay, let's face the flag. I pledge
Allegiance to the flag
of the
United States of America and to the republic for which it stands,
one nation, under God, indivisible, with liberty and justice for all.
Amen. But that was really kind of bad, guys. We could do better than that.
It's Zoom.
Please.
It's Zoom.
Can still do better. I agree with Bill.
Time for We Care with Tom Fox.
I am here. Welcome, everybody. Just a couple of things. First of all, I think it's great, good news that the vaccines are working. Many of us have had them already, and our area is moving out of the purple tier. So I think things are on the upswing, and that's for all of us. On the other side, Myanmar continues to have issues, and as you know from a few weeks ago, I'm very close to that situation and very caring about what's happening to the people in Myanmar, and I hope that gets resolved soon. Other We Care items.
Yeah, I'll give you a week here for Jack Brass. He's been having some health issues last week, so keep him in your prayers for health and recovery. Thank you.
Is this in addition to his the shingles?
Yeah, the shingles. No, this is a little more than that. So, yeah, thank you.
Anybody else?
Steve Baker. Yeah.
Steve?
Yeah, I'd just like to pass along a sad note from my family. I have a 45-year-old niece that lives in New Jersey that passed away this Sunday from COVID. She and her family all got infected about 2 months ago, and she was in and out of the hospital a few times, ended up being put on a ventilator, and then finally ended up passing away on Sunday. She leaves behind a 12 and a 13-year-old son and daughter. And this has been pretty hard for my family because she was the flower girl in my wife and my wedding. She was one of the maid of honors in my daughter's wedding, and my daughter was in her wedding, and she is my son's godmother. So it's been pretty sad the last few days here.
Yeah.
Sorry to hear that,
All right.
Steve.
Sorry to hear that.
Yeah.
Our best to you.
Yeah.
Other people. Nancy, give us an update.
There is no update. Everything is still the same.
Okay.
But you look good, Nancy.
Well, that's because you and James fed me that hot pot.
Viewed a little bit.
Anybody else? Okay, Ginger, I think it's back to you.
Okay, thank you. So Don and Julie are away for a couple of weeks. And Ricky, do you have any songs queued up in your communication with Don?
I do, just a second.
Awesome, thanks, Ricky.
Time's up.
Need some help, Ricky, with that PowerPoint?
Yeah, if you can make my computer go a little faster, that would be awesome.
Tom will be right over.
I'll work on it.
Rotarians, today's song is This Little Light of Mine. And I want you to sing it fine like I know you can. Let's go. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. This little light of mine, I'm gonna let it shine. Let it shine, let it shine. Everywhere I go now, everywhere I go, I'm gonna let it shine. Everywhere I go, I'm gonna let it shine. Everywhere I go, I'm gonna let it shine. Let it shine, let it shine, let it shine. Life is best, life is best with a four-way test. I'm gonna let it shine. Life is best with a four-way test. I'm gonna let it shine. Life is just with a four-way test. I'm gonna let it shine. Let it shine. Doing good, come on. Doing good and having fun. I'm gonna let it shine. Doing good and having fun. I'm gonna let it shine. Doing good and having fun. I'm gonna let it shine. Let it shine. Let it shine. Let it shine. Yeah.
Awesome. Okay, thank you, Ricky. And for our inspirational moment, Ricky, back to you.
Okay, I'm unmuted. Good. All right, just a second. Got to pay attention to the guy behind the curtain here. That's a Wizard of Oz reference, in case you don't know. All right. Well, first of all, I want to say to Don, he took the being in a virtual meeting to a new level of being virtual on virtual. So way to go, Don. About 10 o'clock this morning, Mark Tanis called me and was asking about the recordings from our meetings being up so that he could post them onto YouTube. And all of a sudden it hit me that I had to do the inspirational moment today. You know that feeling of dread that hits you when you have to present or speak in about an hour or two and you've had absolutely nothing prepared in advance? Yeah, that's the feeling of dread I had that hit me right then. And I was feeling a little bad, feeling a little sorry for myself because of different things that have been happening. I'm like, oh no, another thing, we got to add this to it too. So I thought, well, who inspires me? I'm going to go to Dale Carnegie. And many of you know who Dale Carnegie is and his famous book, How to Win Friends and Influence People. So what, of course, is the first quote that I saw? Feeling sorry for yourself in your present condition is not only a waste of energy, but the worst habit you could possibly have. And I'm thinking, thanks, Dale. That helped me. Appreciate it. So moving right along, it isn't what you have or who you are or where you are or what you are doing that makes you unhappy or happy. It is what you think about it. The only way on earth to influence other people is to talk about what they want and to show them how to get it. I love that quote. A contemporary of his, named Frank Bettger, who I also love, said it slightly differently. Find out what people want and help them get it. Dale also said, talk to someone about themselves and they'll listen for hours. That's really amazing, isn't it? How people will do that. You can make more friends in 2 months by becoming interested in other people than you can in 2 years by trying to get other people interested in you. The world is full of people who are grabbing and self-seeking. So the rare individual who unselfishly tries to serve others has an enormous advantage. He has little competition. This is what I think of when I think of Rotarians that are not self-seeking and are unselfishly trying to serve others through the club and community service. So hopefully that fits all of us in here. A couple more and we'll be done. When dealing with people, let us remember that we are not dealing with creatures of logic. We are dealing with creatures of emotion, creatures bristling with prejudices and motivated by pride and vanity. Don't criticize. And the last one, I think this is a great one to end on. Instead of condemning people, let's try to understand them. Let's try to figure out why they do what they do. That's a lot more profitable and intriguing than criticism. And it breeds sympathy, tolerance, and kindness. To know all is to forgive all. Love, Dale Carnegie.
Thank you, Ricky. That was awesome. Nice at the last minute. Dale Carnegie is one of my all-time favorites. I read the book in my 20s, and it actually really did change my life and direction completely. Although I haven't always done everything that he's outlined, that's been a source of inspiration. So thank you. That was awesome. What I do remember is never, ever criticize anyone for anything. And he had a lot of influence in that. I used to be a bit critical in my 20s of people, and that really was impactful. So that was awesome. Thank you so much, Ricky. We appreciate that. Do we have any visiting Rotarians and guests?
We have Rachel Finnegan, who has applied for membership into our club. Thank you very much. And hopefully by next week's meeting, she will be a member. So that's the only visitor we have right now. And back to you.
Welcome, Rachel. Nice to have you.
Thank
Welcome,
you.
Rachel.
Welcome, Rachel. Welcome back.
I'm still on the guest pass version, so hopefully I'll be a member next week.
It'll be exciting, and pretty soon we'll be seeing you in person. That'll be awesome.
Yeah, great. Thank you.
It also probably means that we owe you 3 lunches.
Exactly right. She would have gotten free lunches if she'd have been on the HAPS plan.
Yeah. Awesome.
Thank you.
Welcome, Rachel.
Thank you.
Okay, now it's back to you, Ricky, again. This time for our Rotary International video.
Okay.
This is a true story about a disease so prolific it has been called the world's greatest crippler. This is a tragic story that has affected millions of people, especially children. Polio is an invisible enemy causing fear, pain, and suffering. I'm David Hurt, polio chair for District 5790. As I gave some presentations to various clubs throughout our district, I found that many of the members of Rotary had no idea what polio was all about. So I wanted to take this opportunity with you to share a story about polio and a story about Rotary and its involvement to eradicate polio. At the height of the polio epidemic, fear was rampant. Hospital wards filled with polio victims for whom iron lungs provided the breath of life. Texas received its first iron lung in 1931. The most cases of polio in Texas was in 1952 with a reported incidence of 3,984 cases, just prior to the massive inoculation of the Jonas Salk vaccine. Everybody, old and young, wanted to receive that vaccine. For many years, polio changed our lives. Communities frequently closed schools, theaters, even swimming pools in an effort to stop the spread of this highly contagious polio virus. Can you imagine the reluctance of a researcher to inject someone with a live polio virus? One reason the preventative cure took so long was that a dead, inactivated polio virus immunization had to be proven effective. Just finding a source for the virus for testing was a story of itself. During the field trial, it is amazing that 35,000 children in Houston representing 75% of the population at that time, between the ages of 1 to 6, agreed to participate in an unknown field trial of the Salk vaccine. This action was due primarily to the frightening momentum of polio in Texas in 1952. While Dr. Salk's vaccine represented a tremendous breakthrough, it left a 10 to 30% margin of error. This opened the door for the next advance in immunology from Dr. Albert Sabin. In 1959, Dr. Sabin invented a vaccine. This vaccine used a live polio virus and an inoculation that did not require the use of a syringe, but could be administered through the mouth. The silver bullet, if you will. The problem became finding a silver gun to fire these immunization bullets, and distribution became the primary problem. On 29 September 1979, RI President James Bomar gave 2 drops of oral polio vaccine in Manila, thus launching what has been an incredible 37-year effort to eradicate polio. Since then, our Rotary International commitment to eradicate polio, together with our member support and collective worldwide efforts, should make each of us proud to be a Rotarian. In 1917, at the Atlanta Rotary Convention, President Arch Clump stated the need for an endowment fund. An initial donation to get this started of $26.50 was contributed from the Rotary Club of Kansas City, Missouri. If your heart so moves you, I hope you will join me by also contributing $26.50 direct to the Polio Plus Fund. For ease of contributing, just go to www.endpolio.org/donate. When this debilitating disease is finally eradicated from the face of the earth, won't it be nice to tell our children and our grandchildren what a tremendous accomplishment that we as Rotarians have achieved? This will be only the second disease ever eliminated. To date, an estimated 15 million children have been freed from this debilitating disease. About 2.5 billion children have been inoculated, representing 1/3 of the world's population, not counting the millions of hours donated and approximately $1.8 billion from all Rotarians. Fortunately, we have a strong team in our district that is working together to raise donations and contributions to fight this disease throughout the world. I'm so proud of each and every one of them, not only because of the friendships developed, but because of the end result. You know, after learning so much about polio, I've learned that it's impossible not to be excited about the work Rotary has done in saving so many children's lives from the paralysis of loss of a leg or loss of an arm, or even worse, confined to an iron lung for the rest of their lives. To do this and to save one child from this is so significant. But to put 15 million children in that number is just almost incomprehensive. It makes one really proud, makes me proud to be a Rotarian. To help, I hope you will become as passionate as I have become after learning what Rotary has done to eradicate this disease, and that is to initiate a donation through specifically the Polio Plus Fund of $26.50. Your contribution will buy many doses of vaccine to make sure that this disease is eradicated from the face of the earth.
Thanks, Ricky. That was inspiring.
That was powerful.
Very powerful. It's good to be a Rotarian. Now it's time for any announcements from our board members. I know we do have a few announcements. Steve and Bill.
Bill, you want to kick it off, Bill? Yeah.
Sure, I'll start. Thank you. So PETS was last weekend, and I attended all the sessions. It was very motivating, and I'm excited about the next term. The district is starting to put together a training schedule, or they have a training schedule already together for various positions. And a new committee in our club is going to be called Public Image, and it's going to be chaired by Mark Tanis. And on that committee is Anshu Methi and Lisa Freitas as well. And they will be improving our visibility in the community and in the world, and perhaps bringing more members into our club, through that visibility. We are actively searching for a treasurer for next year, and a club fund chair, and then several of the committees need additional members. So we need some members to step up and take a role. We lost Todd and Beth for running the Spirit Run. So this is very important if we want to continue our largest fundraiser of the year, that we come up with a new chair for the Spirit Run. And then instead of calling it a co-chair, I'm kind of calling it an assistant chair, because what we'd like to do is set up a process where the assistant chair becomes the chair the following year and then brings in another assistant chair. So if you guys can recommend somebody to do that role, that would be great. The leadership team would love to see that. The district training assembly is going to happen on Zoom starting April 24th over 4 different sessions on different dates. And I can put those in the chat. The RI convention this year will be virtual, and so everybody can attend that. Don't have to take a plane to Taipei. And the district conference will be live in person this year at the Gilroy Gardens. So that'll be in July. It's a long ways off, but it's something to look forward to. And maybe as a club, we can plan on all of us attending that. I think it would be really fantastic. That's about all I have for right now, Ginger.
Thank you, Bill. And Stephen Dorn?
Thank you, President Ginger. Just a quick update that I know you're all getting a little thirsty, right? So next week, the day after St. Patty's Day, we'll be doing a third Thursday. So hopefully you'll be able to wear some green, and maybe you have a green beer with you so you can join us. I'll send out a Zoom. Oh, we already got somebody started, Kurt. Nice.
Is this going to be in person, Steve, or virtual?
I don't know. What does the club feel like? I mean, we could probably do it virtually, depending on, or I mean, in person, depending on the weather. But it just depends on what everybody thinks. So I don't know what everyone's thinking about that.
What about doing the outside park near Nancy's house again? That would work if we, that way we could be outside and distanced and all that.
Yeah, I like that.
I like
because,
that idea.
Yeah, we'll have the we got end of daylight savings, right? Or it's coming up this weekend, so we'll have another hour of light. So let's do that. So we'll make it 5 o'clock and I'll put all that into the Zoom information. So great idea. Thanks, Ricky. So
Awesome.
That's it.
Good. Bring your green everything.
Yes, green
Yes.
everything. Yeah.
And bring a jacket, because the high on that day is supposed to be 68.
Okay, great. Thanks, Steve.
Sure.
Any other board members that I missed? Okay, very good. Now it's time for our special presentation. And Steve McCoy-Thompson, you are here, correct? To
Yes, I am.
introduce your wife? Okay. You'll just be leaving at 1:15. Sounds good.
Thanks, Ginger. Really appreciate it. It's really my distinct pleasure and honor to introduce Meri McCoy-Thompson. I could give you a long involved history, and she's wonderful. But most importantly for our purposes, she's the COO of Dovetail Learning. And they're doing really, I think, really significant work in throughout the country, and particularly in the state, in addressing issues of resilience, which have become really important for adults and children, particularly during this time of COVID. So thank you, Meri, for joining us.
Thank you. I'm so happy to be here. I'm going to share my screen, and let's do that. Okay, so I'm from Dovetail Learning, the CEO of Dovetail Learning, and our approach is called We Are Resilient. And today, let me get this right here. Our mission is to strengthen resilience in adults and children, and our vision is to create a world of kind and connected human beings. And oops, somehow I missed my, let me go back, missed my, here we go. This is the important thing. I wanted you guys to have a sense of what we're going to be talking about today before I jumped in. So first, we're going to just talk a little bit about the pivoting that we've done over the last few years, especially with COVID, but just because of our organization, the learning we've done. We're going to give you a sense of what we do and why we do it, what problems does our approach solve, and why we've chosen the approach we have. And then we're going to give you a quick glimpse into how does We Are Resilient, how does our approach work, and then give you a little glimpse into how you can get involved. And I am happy if you have any questions along the way, feel free to interrupt. You can just unmute yourself. You can send stuff in the chat. We can have time for Q&A at the end. So my goal for this to be interesting and interactive. So we'll see. Back to our mission and vision, which we just talked about, strengthening resilience. So Dovetail Learning, the focus on learning, has had a lot of learning over the last few years. At Dovetail, we began by providing a curriculum for social emotional learning for children. And this kind of curriculum, if you're not familiar with social emotional learning, is really around emotional awareness and regulation. So children have a sense of how to handle themselves for themselves, and also social awareness, how to do apologies and forgiveness, and how to really relate to other people. As you can imagine, these are really important life skills. There's a lot of different types of programs that are trying to do this. And with COVID and learning distance learning, of course, you can imagine how this has become even more important. So as I said, we first focus on children. And we provided training for curriculum for teachers, for administrators, and other school staff. And then we also provided materials for family support. So this was all well and good. And we did this for about a decade. And we did this starting in California, but our program grew nationally. We were actually really used to doing Zoom training because we were doing training across the country. In addition to in-person, we would fly all over the country to do this kind of training. We also had some programs in about 5 different countries. And so we were, kind of chugging along at this. But along the way, we were really noticing that there were some resilience challenges. And this is true for the healthcare providers, but educators, which is where we were really aimed at. And a lot of that, of course, is just burnout. People would just get so frustrated by their particular work. And some of that was called by, compassion fatigue or vicarious trauma. So people who worked in particularly high risk populations, with the poor, that all the things that they would go through, the teachers, the educators, the healthcare providers would just absorb their issues and really feel like they were unable to solve them. And they would get burnout. It's just the difficulty of working and feeling like they were unable to make a difference. So that was the 2 things. And then the third thing was the biggest thing we understood over time was that the people who were teaching the skills really needed to learn them first. So they were being asked to teach these kind of skills, resilience skills, social emotional learning skills, and they had never really learned them themselves. So that was the biggest challenge. And we also know referral systems are often unsuccessful. So if you have someone come into your classroom, someone come into your clinic, and they have a problem, and here's a healthcare provider, here's a mental health care provider, you can see behavioral health. For many different reasons, children and families were not able to access those. So looking at all those challenges, we're like, we really need to do something more. And so we kind of broadened our view from just children and went to see how can we provide whole community support? And we realized that this training really needed to be focused on adults. So we had this curriculum for children and we were training adults in it, but it didn't really speak to the needs of adults. And we're like, so we totally threw that out started from scratch. And this was about 6 months before COVID settled. We started looking and really working on developing an approach that would work for adults, and that whole communities would have a common language to foster adult together. There's some more things that, in order to do this, for adults to do this, we understood that in order to have this approach, that to be a change agent, that people needed to practice them themselves. And so we really focus on the practice model coach approach. If you practice it enough, and then you're able to model it so other people can learn from you, and then you're able to coach using curiosity, inquiry, and encouragement. Too often with our previous curriculum, teachers would tell students things like, you know, sit down and learn to regulate yourself, or things that didn't really make sense because the teacher was upset. The teacher was not calm and collected when they were doing it. They were telling the kids to do things. And as we all know, especially for parents or grandparents, children learn much more by watching you, by what you're modeling, than what you're telling them. And so we really focus on the practice model coach, and we focus on what adults can do. So that was one whole set of learning, and we started pivoting and creating this curriculum. At the same time, we became aware of a big initiative that was happening in the state of California, and because we were working with healthcare providers to try to develop some of this curriculum, and it's around what toxic stress and trauma does. So there's really three kinds of stress. There's the positive stress, the stress that I felt before coming on and making sure I'm prepared. We all have that stress in our life. Then there's the tolerable stress that might be bigger for those of us who have personal loss, people who've lost jobs, other kinds of things. We can't just recover right away. We might need a buffering relationships or other things, but eventually we recover. But if we're in that kind of high stress all the time, or if for an extended period of time, or if it's really extreme, if we have really hard things that happen to us, or it's frequent, things like abuse, neglect, discrimination, we need something more. We need healing and regeneration. And one of the big things that has come out in the medical community in the late 90s, and there have been hundreds and hundreds of studies that have proven this since then, is that there's something called adverse childhood experiences related to this toxic stress. These are things like physical, emotional, and sexual abuse, neglect, and household challenges, anything from intimate partner violence to substance dependence and other things that can happen in the house. And these adverse childhood experiences really ratcheted up our stress experience, and we have a toxic stress response. And this is when our body is functioning so that our cortisol levels are up, our blood pressure's up, and so over so much time, that the inflammatory reaction that happens in our body starts to do real long-term damage. And it's significant. The statistics are 60% or more of Californians have one adverse childhood experience, and there's like 16% who have 4 or more. This adverse childhood experience, everything from generational embodiment of historical trauma, social conditions, all disrupt neurodevelopment. They can create risky behaviors. Even without the risky behaviors, they create disease, disability, and social problems. People with 4 or more ACEs have 20% 20 years less of life expectancy. It's a real health problem. It's a big public health problem. In fact, the Surgeon General of California, Nadine Burke-Harris, has used it as her mandate. Of course, COVID came along and she's dealing with both, but to reduce ACEs within a generation. 9 out of 10 causes of death, the primary causes of death in this country, are exacerbated by ACEs. So if we can reduce ACEs, adverse childhood experience, if we can reduce toxic stress, then we can improve our health. We were granted a big grant by the state of California to do this work, and it's an initiative called ACEs Aware. And the mission of ACEs Aware is to save lives by helping providers understand the importance of screening for adverse childhood experiences. If you go into your doctor and your doctor screens to see whether you've had an adverse childhood experience, they can then take a different look at what's happening with your asthma, what's happening with your diabetes, what's happening with your heart. All these things that are affected by this adverse childhood experience and the inflammation that can happen along with it. It also, they want to provide training to providers to respond with trauma-informed care to mitigate the health impacts of toxic stress. through all of this, we've learned that we really need a strategy around universal mental health promotion. There are very few resources for adult social emotional learning or promotion of mental health wellness that can help the whole community. So we want to address both the kind of stress, the everyday stress that we can have and still skills that we can help with cope with it, but also give people some small tools to help with this problem of toxic stress, which is really severe in life, can be life-threatening. So our approach too was that we were going to use research-based practical skills that can help with stress management so that we can also disrupt cycles of trauma to promote healing across generations. We know if we help adults understand how to deal with their own stress and give them skills to do that better, then they're going to be better parents, better educators, better healthcare providers, and we can break the cycle that causes adults who have trauma to teach their children to use unsuccessful strategies to deal with their stress, who then deal with their own children, and understand how things happen across generations. So we want to break those cycles, help with the toxic stress, help with the ordinary stress. So these are the kind of things that we're looking at. Another thing to understand in terms of ACEs is we have these adverse childhood experiences that we've talked about, these 10 different kinds of things, but we've also understand that there's adverse community environments that kind of plant the seeds, create an environment where it's more likely to exacerbate adverse childhood experiences. That's everything from poverty, discrimination, racism, lack of opportunity, and social capital. When you're living in a poor neighborhood or you don't have options to overcome the ACEs. One of the important things to understand with ACEs, adverse childhood experiences, toxic stress, that we do have strategies that can help. It's not a sort of death sentence. Oh my goodness, I have an adverse childhood experience, I'm going to die. But it's just important to understand that you have to take it seriously and do strategies to help. And that's what we've built into this program. The third thing that we've learned as we've gone through this work is that we wanted to create our materials as open educational resources. In other words, all the digital copies of our work is available for free. You can download it, you can adapt it. As long as you give attribution and share back, you can do whatever you want. We didn't want to make our program something that's locked down, that you always can only get for us, because we understand if we're going to scale this out to the world, and we believe so many people need it, pretty much all of us need this approach, that we needed to make an open educational resource. So those were sort of the three things we took into account as we were trying to figure out where to go with this. And we were just getting We Are Resilient up and going, and then COVID hit. And luckily, because we had done the Zoom training, we understood what we were doing. On the day that the governor announced the lockdown for the state of California, we started our first Resilience Circle for parents. So since then, we've given dozens of free resilience circles for parents, for families. We've done them for healthcare providers, for educators, the first responders through the city, San Francisco Fire Department. We have juvenile justice looking at it, in-home healthcare. So there's a lot of groups that are coming to us and understanding, oh my goodness, we really need this. So what exactly is this approach? We've talked about what problem we're trying to solve and why we were trying to solve it. So what does this actually look like? Our practical skills for lifelong wellness. Well, first of all, it focuses on strengths. This is another thing research has taught us over the last 20 years, that we all have strengths. We are all resilient. In fact, that's why we named our approach We Are Resilient, because we want to emphasize that we are resilient to start with. We also know that as we learn to strengthen our resilience skills, we also need to understand what's holding us back from choosing resilience. And those are our cultural patterns and our protective patterns. And then once we notice what's holding us back, it helps us choose our resilience skills. We have them in three buckets: our centering skills, our connecting skills, and our collaborating skills. We also want to talk about how to practice model coach. We all practice this. This is something I do all the time. I practice it myself and I'm able to coach. I can't coach anyone without being able to do it myself. And everyone we talk to about it, we emphasize this approach. And then we also have resilience mindsets. The resilience mindsets of curiosity, choice, and commitment. Those are the things that are going to really help us embed this into ourselves so that we can become the people that we want to be. One thing that's really important to think about when we talk about resilience is it's an ordinary superpower. It does not come from rare and special qualities, but from the everyday magic of being human. As I said, we're all resilient. The other thing that's important to think about it is that it's a spectrum. It's not something, oh, I'm resilient, I check the box, I move on. It's not binary. One moment we may be choosing great resilient skills and something comes along and happens and we're totally not very resilient. So we have resilience in a lot of different categories and we move through them throughout the day and throughout our lives. This is a view of the skills and patterns that we talk about. We have our cultural patterns that give us cultural resilience. And this is really how I view the world. I view my world through my cultural patterns. We also have our protective patterns. Those can help us and harm us, and we try to assess whether they're going to help or harm. And that's how we react to the world. That's sort of our default way of reacting. Then we have our skills. We have our centering skills, our connecting skills, and our collaborating skills. So that just gives you a view of the whole approach. As I said, the cultural patterns is how we view the world, protective, how we react to the world, and the skills are how we create the world that we want for ourselves and our families. So how does this work? So the first thing we teach is how to notice our short-term stress response. So we can go along center and everything's good, and then we have a stress trigger coming in. For me, for example, it was my husband saying, oh my goodness, can you do this presentation on Thursday for me? And so I'm like, oh my goodness. And at first I went into one of my protective patterns, which is avoiding, oh, I don't want to talk about it. We can't talk about it now. We'll talk about it later. And then, you know, what other protective patterns? So you kind of go into this reaction and you can get really agitated, upset about something, whatever it is. Maybe you're a doctor and the patient's whacked out or whatever situation you have in your life. You reach this peak and then you need to calm down. And it can take a while to calm down. We can feel really depleted, and then we take a while to come up to centered. So this is what's happening in our lives every day. You know, I was on the phone with IT two days ago, and I certainly went through this because an hour and a half on the phone with, you know, customer service department when their website wasn't working and I couldn't do what I want. I just went woof, up and down. Now, our goal is to learn about our resilience mindset, of curiosity and choice, so that when a stress trigger comes, we notice our protective patterns. We wonder and assess, is that useful? Are we curious about it? And then we choose our resilient skills. So in that instance, when I was on the phone with IT, I had a negative encounter. We can say I was attacking the guy. I was really upset. Then I asked to speak to the manager and I was able to take a breath, which is one of our centering skills. And then that was not helpful. What can I choose to do instead? And I made a different choice when I spoke to the manager. We had a much better encounter. And it's just how you use your resilience mindsets to notice your protective patterns, wonder and assess if it's useful, and then you can choose your resilient skills. Just an example, here are some of our centering skills, the centering skills of noticing myself, breathing mindfully, as I talked about. It's letting go, finding gratitude, positive reframing, and nurturing myself. These are just the centering skills that we teach. And they're an example to give you a sense of what kind of skills that we teach. And we have those kind of skills in each one of our categories, and in our patterns, we deepen our experience of those. And then we have our resilience mindset of curiosity, choice, and commitment. So how does We Are Resilient help your clinic, school, or family? We basically teach practical science-based resilient skills to mitigate stress and trauma. And it enables people to coach students, family members after they learn it themselves. And it can help with team building, collaboration, and support. And it basically incorporates trauma-informed care and cultural humility. We have all sorts of different resources. We have a bunch of different digital resources, different kinds of books. I guess I don't have any right here in this room. Steve can show up. They're in the room upstairs. And we have books that you can buy, physical books. And we also have webinars. We have resilience circles. We do coach training. And we also have a whole series of videos. We have whiteboard videos. We have coaching videos. So we have a whole lot of video things that can support. And then what do I need from you? If you have any ideas of partnerships, like I said, we've been getting requests from all sorts of different types of places. If you have places you think would be good, referrals, spread the word. We're always looking for pro bono help, donations, help with fundraising, or you can just join our newsletter and learn more about what we do. So, and if you're interested in bringing We Are Resilient to my group, this is our website, dovetaillearning.org. You can always contact me or contact my colleague, Christy. So I've said a lot in a very short period of time. Do people have questions, comments?
Yeah, thank you, Mary. I'll just say that this is really the tip of the iceberg of what they're doing. And it's all, I know it is sort of like drinking from a fire hose, but I thought it was great. It tells a great story. And I know we've all had stress in our lives. And so I know we can all identify at some level.
So Mary, I do have a question. This is Ginger.
Hi, Ginger.
This is so important. When you said 60% or more of Californians have had some sort of childhood trauma, this is really critical. So thank you for what you're doing here. What motivated you to get involved with this?
Oh, that's a really good question. I've worked in nonprofits my whole life. I've worked both in education and healthcare. Early on in my career, I was a project director for the creation of national guidelines for health supervision for infants, children, and adolescents. And that actually created a guidelines for preventive care. So what should preventive care look like for kids? And it was adopted by the American Academy of Pediatrics, as along with a whole host of other organizations. And it became the standard of care for training for them. And in fact, now if you mention Bright Futures to a lot of people, they're like, oh yeah, of course, they've been trained in it. And pretty much everybody in the last 20, 25 years. So that was sort of my introduction to how important health prevention can be and what a difference it can make for kids. I've also done a lot of different work in education around the world. I've worked with nonprofits, and at every juncture, it was like, how can I make the most difference? How can I help people really achieve their potential? And I did everything from income kind of programs to training, computer training kind of programs, all sorts of things. When I came across this program, it really spoke to me at a deeper level, because we're talking about how to change people's perspectives so that they react together, they react differently, so that people can really connect. We're hardwired for connecting. We're hardwired for really having deep, meaningful relationships with one another. And there's so many things that are blocking that with people. So to come across a team of people, and I work with an amazing team of people who understood the importance of that and how to make a difference, and understood that creating things that were simple and easy to access and easy to understand and easy to implement that could make a big difference for people was really important. I saw that the market really didn't have anything like that. And I felt like this is something that no matter where you are in life, your age, your social economic situation, your cultural situation, where you live in the world, this is something that could help you. So I think that opportunity for really deep impact and really broad impact just motivates me every day.
Thank you, Mary.
Any other questions?
Yes, this is Larry Annis, and thank you very much for your presentation, Mary. My question is, where do you get most of your clients, for lack of a better word?
Oh, that's a really good question. So previously we were doing this program for schools, right? And so basically teachers would use it, they would love it. And a lot of times teachers move around for various reasons. And so they would tell their new school, and they would come in and they would call us. And so it was pretty much word of mouth through the education market that way. And when we started our new program, of course, we're like, okay, we'll do it the same way with the same teachers. But then of course, COVID hit. And I'm sure most of you understand the education people, even though they need this tremendously, have no time or energy to even think about their own resilience with the whole distance learning and getting back to school. People are so over the top in the education field. And so it didn't spread like that through education like we thought it might, but it has now through the healthcare sector. So we started working with healthcare people, and then they would tell their friends. So it's really primarily word of mouth at this point. People, part of it is the people who've been thinking about adverse childhood experiences, and there's been professionals who've done it for 10 or 15 years and trying to figure out how to deal with the people that they are serving. So people who are really far along in thinking about it, they're the ones who jumped on us right away. So we have a coach certification program that we did not think people would be interested in for a year or two, right? Till we really got our name. And there are clinics both in the Bay Area and in Southern California that as soon as they heard that we had this program and that we had money to train coaches, they signed up right away. They signed up all their clinics. La Clinica in Concord, I think they have 10 clinics, and they have all of them are taking.
I think we lost her.
I think her feed might have frozen.
Yeah, we lost her.
Yep, looks like we might have lost you for a moment, Mary. Can someone type something to her? Maybe she can see the type.
Oh, here she is. She's back.
How far along was I?
Yeah. You were just talking about the multiple facilities you had in Concord at La Clinica.
Okay, so not very much. Okay, so I basically after that I just said it's starting to. Those people are telling other people now, and they're coming along. They're calling us and getting referrals. So I would say most of our things are from referrals, and we're just starting to kind of get the momentum where people know about us.
Thank you very much.
You're welcome. There's also an organization called ACES Connection, which has 50,000 members worldwide. And these are people who've been working with the issue of adverse childhood experiences for a while. And so we're starting, that's also a great source of people who are interested in our work and learning more about it.
Thank you, Mary. Anyone else? Mary, how can we learn more? Do you have a website?
Yes, dovetaillearning.org. So that was my last, dovetaillearning.org.
Great. Thank you, Mary. This was great.
You're welcome.
Thank you for your presentation. Does anyone else have anything they would like to bring to the table before we close? Okay. Awesome meeting, everyone. Hopefully we'll see you next week, and then look forward to Thursday soon, and looking forward to seeing you all in person soon. Have a great Thursday. Bye, everyone.